Priyamji, I want to focus on one a part of the pandemic, which I think was, one of the most difficult times for our country, and that was the time of the second wave. Now, on one hand, you had rising cases and the health crisis that was really devastating for people, and on the other hand, there were many opportunistic and subversive elements who were recklessly exploiting the situation, and they were doing that through disinformation, misreporting, creating chaos by every means possible. Can you
Yeah.
tell us what exactly was happening in during this time from your research?
So, so during the first wave, we were sort of luckier than many other countries because the virus hit us much later than most of them. So we could see the devastation that it was causing in other countries and we could react accordingly, right? With the second wave, the new variant originated in India. So by the time we figured out what the clinical symptoms were, the massive need of oxygenation, it had already, because of its high transmissibility, it was already spread, in community. There was already community level spread. So we had to very quickly augment, oxygen generation and transport. Now, unfortunately, most of our oxygen generation happens in the eastern parts of the country.
Right.
And the severity of the second wave was in the western and northern parts of the country.
Right.
So to get that oxygen to these parts where the wave had, was hitting the hardest, it was taking anywhere from 7 to 9 days, to transport that oxygen. The government had to, then figure out that okay, they cannot fly full tankers, even if the airport steps in, it's flammable, it's going to
Yeah.
burst. So they figured out how to transport it via rail, full tankers, and then transport empty tankers back via air, and they cut down the time to 1 to 2 days, by doing that. But all of that is a learning process. It took a couple of weeks, and those couple of weeks were very, very challenging.
Yeah.
Now, during those challenging weeks, so this is the most disturbing part, that when your country is at its weakest point, and when elements exploit that situation politically as well as in the media, that's when you really can call it, call those elements working against national interests, right? Now, if you look at what happened in Delhi, the Delhi government asked for 5 times more oxygen than
Yes.
even other opposition states like Maharashtra and Kerala when they had the same number of cases. So when the Supreme Court formed that task force and they figured out that Delhi was requiring that much more oxygen and not even asking the government for it, because the government of India for it, was going to the court to ask for it, So why did it require that much more oxygen? And what did it do with that much more oxygen? There is no accountability. And what about the people who died because they didn't get oxygen because Delhi hoarded all of it?
Yes.
So so that kind of, and when when the chief minister of Delhi then just comes and tweets that okay, I was looking out for my people and what wrong have I done and all of that. You cannot just let go of your responsibility like that, right? You are responsible for all those additional deaths that didn't, that happened because they didn't get that oxygen that we took away.
Absolutely. Absolutely.
And the international media just sort of like pounced, on India.
Please remember to subscribe to us and switch on the notifications for this channel. For our other social media links, more content, and to support our work, please visit citti.net. Dhanyavad. Namaskar.